Good morning, everyone. My name is Camping Yuan. Welcome to listen my presentation. Do you know that there has 70.9 million deaths annually worldwide because of cardiovascular disease? And we know that more of the cardiovascular disease will develop to be heart failure in the end. Number of 26 million people has suffered from the heart failure today. Therefore, we should have a better know about heart failure. So I will present the I will present the clinical manifestation of the heart failure, and the case study of Mr. Brown will be discussed. Firstly, what is heart failure? Heart failure is a condition. Heart failure is a condition disease which has many complex symptoms. It will occur when the cardiac structure or function is abnormal, which will lead the heart muscle cannot pump enough blood for body. There has many different types of heart failure. It can be chronic or acute, and the left, right, or both sides of the heart. Here are some common causes of heart failure: heart attack and coronary heart disease. Moreover, old age chronic conditions such as diabetes, hypertension, and thyroid conditions also increase the risk of heart failure. Now let's focus on Mr. Brown's case. She has been diagnosed as acute exacerbation of chronic heart failure, and we know that Mr. Brown is 70 years old and has a history of heart failure. The patient will suffer from dyspnea, and her oxygen saturation is 95% on room air, which means the patient is anxious. The blood pressure of patient is 170 and 95 millimeter of mercury, which below hypertension level. Her heartbeat rate is 120 beats per minute. Dyspnea is the main clinical manifestation of heart failure. When the heart failure is happening in the left side heart, is intracavity filling pressure will be increased because of the left side vascular dysfunction, which regurgitation, then the blood flap to the lungs, which will cause dyspnea and increased rate of breathing. This is also the reason why Mr. Brown's respiratory rate is 24 breaths per minute, which is faster than the normal rate. Next, let's move to the circulation of lungs. We heard cracker sound in the broad lung base. Cracker is a high-pitched brief sound. It occurs when the alveoli filled with fluid, which means the patient has pulmonary edema, and is caused by pneumonia or heart failure. Therefore, we could note that Mr. Brown had pulmonary edema caused by her heart failure. When heart failed to pump blood will back into the vein, and the blood will stay in the pulmonary circulation. This will increase the pressure of pulmonary capillary vein. Vein is higher than choroid osmosis pressure in lung capillary, the fluid will come out from the vein, leading edema. Then we also could find that the patient has tachycardia. This is because the heart compensation. When heart muscle does not have enough power to pump enough blood for body need, heart will try to provide enough blood. So when one type beat is not enough, heart will beat one more or two more times to reach body need. Therefore, heart failure patient has faster heart rate. In the end, I would like to conclude some main points of heart failure to finish my presentation. First one is heart failure normally happen in the old age group people. Second, hypertension is a high risk leading to heart failure. Next, heart failure will cause pulmonary edema. And the fourth is heart failure also called tachycardia. Overall, Mr. Brown's case, it is easily for us to identify heart failure clinical manifestation. As a nurse, we should provide good nursing care for them, such as keeping the patient in high floral position, checking their vital signs frequently, and monitoring their fluid intake and output, also the daily weight. Here is my reference. Thank you for your listening.